Today on Forbes, this startup has a new way to quit smoking. Will this be the one that works? 6 years ago, in a townhouse in Santa Monica, Mario Danek began tinkering on a device to help cigarette smokers quit. After buying nebulizers, syringes, gaskets, battery packs, electrical firmware, and pharmaceutical-grade nicotine liquid, Danek, who had recently sold his stake in a vaporizer company, took everything apart and hacked together a functional prototype. It wasn't pretty, but it worked. The 39-year-old Danek says that the first device had a, quote, Frankenstein look. He adds, quote, I used a syringe as a liquid vessel, and there were a lot of external wires because I'm not good at soldering. Danek brought the prototype to Greg Smith, founder of Evolution Venture Capital in New York, and he was intrigued enough to cut Danek a check along with San Francisco-based hedge fund Poseidon for $500,000, and Qnovia was born. The company, which is based in Virginia, has since raised $35 million from investors that include Blue Ledge Capital and Vice Ventures at an estimated $350 million valuation. Now Qnovia is hoping to become the newest player in the $3 billion in global annual sales nicotine replacement therapy market. But it can't start selling its device in the US or booking revenue until it clears the Food and Drug Administration. Qnovia was approved for an investigational new drug application by the regulator in October and plans to start human clinical trials before the end of the year. If it gets FDA approval, it will become the first federally approved prescription treatment for smoking cessation on the market in nearly 2 decades. The last one was Chantix, a blockbuster pill containing varenicline and made by Pfizer in 2006. Chantix's patent expired in 2020. The big hook for Danek's product, the RespiRx, is that it does not use combustion, like cigarettes, or heat, like vaporizers, to aerosolize nicotine liquid. The thing with heat is that it creates carcinogenic byproducts, which are then inhaled along with nicotine. Any cessation method involving heating nicotine would almost certainly be a non-starter at the FDA. Rather, Danek's device is a vibrating mesh nebulizer, which uses a circular disc that moves 150,000 times per second to wick pharmaceutical-grade nicotine liquid into an inhalable vapor. The task of bringing the RespiRx to market falls to Brian Quigley, Qnovia's CEO, who formerly led Altria's smokeless products division. Danek now serves as Qnovia's chief technology officer. Quigley says with 28 million American cigarette smokers, there is not enough being done in the pharmaceutical industry to address smoking, which remains the leading cause of preventable death and disease in the country, killing 480,000 people a year. Quigley asks, quote, where else in medicine is the standard of care from 20 years ago good enough? It just seems kind of shocking that here we are in 2024 and this problem has not been solved. Technically, the FDA considers RespiRx, quote, a drug-device combination product, meaning that it's both a medical device and a drug. Qnovia is applying through an abbreviated approval process that allows the company to use existing data from previously approved drug devices, like the Nicotrol inhaler, which was marketed by Pfizer before the company discontinued sales last year. That means the RespiRx's FDA journey should not be as expensive and difficult as it would be for a completely new medication. For that, the average cost is $880 million over an average of 10 years, with a 91% failure rate. But RespiRx's FDA journey is not a slam dunk either. Qnovia has been working on the RespiRx for the last 6 years and has already spent $30 million. Danek estimates the company needs at least another $40 million and up to 4 more years to get FDA approval. And given that's coming from the company's founder, that's probably the best case estimate. The chances are it might take much longer. For full coverage, check out Will Yakowitz's piece on Forbes.com. This is Kieran Meadows from Forbes. Thanks for tuning in.